Hello, everyone. Happy week 5 discussion time. Let's dive into it. This week's topic is roles working with families and couples. So I'm going to talk mostly on family experiences. I have not personally been in couples therapy. However, I think most of what I have to say and sort of my, feelings would apply to both couples and families. So first question is your feelings. How do you feel about working with couples or families? So I personally work with families all the time. I do a series of diagnostics where the family is often here and involved in sort of the procedural care. So although it's not therapy, it's somewhat similar in that I have to kind of explain what we're going to do and sort of walk through the supports and how to inform the family on what to expect. I do not actually provide the results, which is a kind of interesting part of my job and a part I quite enjoy because some of what I see and sort of find can be really, really challenging to discuss with families. So again, I'm a middleman. But I work with these kids and their family, and we try to work together to get through these procedures in sometimes very creative ways. 2 and 3-year-olds do not like my study, and they scream very, very loud, and how to get through that, but also how to sort of get the family helping and not too stressed out over the situation can sometimes just be one of those challenges that I work through. Do you find it brings a different energy compared to other roles I've had? And I would say absolutely. Whether it be that I'm more compassionate towards families or whether it's easier for me or maybe that I care more for the kids, I really try to go the extra mile to make sure that no one feels left out. And I think that's where couples and family therapy probably is more challenging. When you're working on one-on-one, it's far easier to sort of keep control, if you will, or not get distracted with the multiple things going on. I think as a therapist working with either a couple or a family, like it could get at times a little heated and how to intervene and how to appropriately step in or counsel could be very, very challenging. And, there are times where, the dad has a question and the mom kind of interjects and there's not always time for both parties to communicate. So you do see it in the clinical setting, but slightly different in the therapy context. And I think you sometimes have to work a little harder, I would imagine, with a couple and family, just because you're working with more than one person, right? You've got multiple people you're tending to with multiple needs. So I do think it changes. I do think it can become far more complex. And for me, it's something I prefer to do. I think it's really exciting, especially in a kid's world where there are situations where you do kid studies and there are not a lot of parties involved. But in a situation of a family dynamic, it does feel like there's interest and heart and kind of understanding what's happening and being there together as a family. So I think that is, a hopeful sign and a good sign and a challenging sign at the same time to work through. The sounding board. Have you ever found yourself as a sounding board amongst family struggles? So what was the experience like? How did you handle it? And what did you learn from it? So I will say that my parents have an interesting family dynamic. So quick backstory, my parents have been on and off together since they were 15. Not that they were married at 15, but basically they both grew up in pretty sort of rough upbringings. And so they met each other at school when they were 15 and dated kind of off and on ever since. They've even been married, divorced, remarried to each other, and now actually a couple years ago they officially are divorced and separated, probably officially. However, it's kind of one of those weird things where you just never really know. There are times when my parents worked great together and other times when they were completely dysfunctional. So the good and bad of it, I don't say or know that there's ever the perfect person out there, but I think sometimes it was, good that they were together and sometimes it wasn't. As 3 children, I am a middle child, the one straight dab in the middle, and with an older sister and a younger brother. I find my brother was kind of the baby, so he became Switzerland on the island, and then my sister was a little more aggressive and assertive. And so I kind of ended up being a sounding board for a lot of some of the disputes. And I tend to be a little more neutral in the three of us in general, where I can sort of hear and accept a lot more. But it became really, really difficult in a family dynamic, where especially for my mother, it's been a little bit harder in the separation, and there is negative things said. And so it's been very, very challenging to sort of remain neutral, try to be supportive, but also understand where she's coming from, but then also know when to draw the line. And so I've actually had to say, hey, Mom, not okay. And my brother and sister have had to too. Not often. My brother, again, he's Switzerland, and they kind of protect him for whatever reason from things, or maybe it's because he's a boy, because culturally, having a German family, the men are kind of these prized possessions, and it does change the dynamic of the things that sort of he's been asked to deal with, in some good and some negative ways. So definitely been in the midst of a sounding board, and don't like it. Most of the time I can remain calm, but I also find that maybe over the years and through sort of my delving into the understanding of my family dynamic, it has created some definite forms of tension being in the middle, and sort of hearing it from both sides, positive and negative, right? And so, that is how I can relate to that. But it doesn't feel good. And same in the situation of a clinical setting where, say I'm in the middle of two parents that have a social worker and XYZ in some of the trauma situations I have. It can be very complicated. And being in the middle is never really fun. Having parents that don't agree is also kind of complicated. In my own personal experience, luckily for my husband and I, as far as co-parenting in terms of our children, we do rather well and agree on most things. So we haven't run into a lot of big struggles. However, I can see that, if, say, we don't survive and we weren't to stay together forever, what that could look like in terms of where it puts our children and how they would feel communicating to both of us. So having been a child and a product of a divorce and a relationship that was kind of on again, off again, I can see a lot of layers to that, and it can be complicated and a challenge in family therapy. Ethical challenges is the third section, which is sort of the intricate landscape between legal, ethical, and moral sort of struggles working with couples and family. And so are there any specific dilemmas or situations that stand out to you? No, I think for me, I would just really kind of be very curious of the therapist who was involved in that, maybe from the more curious mindset, how they remain neutral. You talked about Dr. Carlos, how, you'd been to several family therapists and how some of them took different perspectives. And I always wonder, say me and my husband did enter into counseling, couples therapy, and the therapist took one of the sides, like what that would look like and how that would be effective. And so I really think couples therapy and family therapy has to be pretty challenging, because you want to sort of maintain a neutrality. You want to also, validate feelings, as you said, with your third therapist, that was the most crucial. I would agree that would be really, really important, and give them tools, right? But communication, which would be the reason my husband and I would go to therapy, if anything, because sometimes we think on different planets, and that's okay. But sometimes how we communicate and how our communication gets across can always use improvement. And so finding a therapist that has the right tools could be tricky, especially within that sort of family and couples category. I think where it could be challenging, or the most challenging, could be in a situation of abuse, whether domestic, emotional, physical. I think that would be a very challenging space to be, and how to, as a therapist, help them through that process would be really, really complicated. Like, where do you start if a problem is so bad? How do you back up, and how do you sort of work through that? Is it worth working on? And does it matter what you think, or do they want to work on it? And really, that would be all that matters. And so I think that I wouldn't like that position. I don't think I would choose to work with couples. I might choose to work with families probably before couples, but I think couples could be very difficult, given that there's just a lot of role stereotypes, or a lot of cultural sometimes differences in relationships, or sometimes things that innately we learn and don't really recognize and what that looks like or how that plays out later in life can be a factor. So all things to think about in the context of exploring couples and family counseling. Couples wouldn't be my top choice. However, I would like at some point in time to do couples therapy. I think you can always learn through someone else's eyes. And often what a therapist has done for me is sort of sometimes even said the same thing maybe my husband has, but coming from someone who's outside of the situation and from a neutral space, it just comes at you from a different perspective. And I think that that is what is always sort of beautiful and helpful in therapy. Is an outside perspective. Often, especially why most people get into fights is because there's not that outside voice or that outside perspective. So it could be great to have couples therapy, but what that looks like as a therapist would be far more challenging. How do you work with just one, and how do you work with both of them? Or maybe there's times where therapists like divide, as you said, Carlos, one time you sat in the car and your wife continued to go in. Maybe there is times where you work on individuals as well as work on things together. And so you bring up a really, really great point through your therapy and through sort of any reason for, communication breakdowns is that the other person isn't feeling heard or listening. And so listening is probably, a great sort of starting point to just, as a therapist, get people in and see what you're capable of as far as what you're willing to do and work with, which is why I think that it's kind of great that there's a bunch of hours that you have to like work up to before you actually practice. So with that said, that's what I have to say. For week 5, I cannot believe next week is the final week. This is going by way too fast. We are going to miss you, Dr. C. And I hope you have a great week, everybody. Thanks for struggling through the listen. Happy Tuesday. Bye.